Now what's crazy about this again is that many of the female cases are asymptomatic, and sometimes they don't even find out that they have gonorrhea until weeks or months down the road till this pelvic inflammatory disease develops. About 10 to 20% of untreated gonorrhea cases will develop into this pelvic inflammatory disease. And some of the symptoms that occur with this are lower abdominal or pelvic pain, abnormal bleeding, so again, bleeding between periods and things like that. And then also you can get something called dyspareunia, which is a fancy pants name for pain during intercourse. Now, one of the other complications, or I should say two complications that we mentioned earlier, is if this inflammation in the fallopian tube or the uterine tube persists, it can cause scarring in there. And one that can cause infertility because it makes it hard for the sperm cells to pass through that scar tissue to fertilize an egg that was produced by the ovary. Also, what can happen, let's say a sperm cell did squeeze by the scar tissue, fertilize an egg up in the upper fallopian tube, but what could happen is that now fertilized egg, it's supposed to descend and implant in the uterus, but that fertilized egg, while it's trying to descend, might get stuck in the scar tissue and implant in the uterine or fallopian tube, and we call that an ectopic pregnancy, and those are no joke. We like to get those treated and taken care of ASAP. So as you can see, these potential complications of pelvic inflammatory disease gives us another reason as to why early testing, early detection, and prompt treatment is so important. Now, the current first-line treatment for gonorrhea is an antibiotic called ceftriaxone, also known by a brand name Rocephin. Now this is an intramuscular injection of 500 milligrams. Intramuscular means it's just being injected into the muscles. Typically it's into the gluteal musculature. Now I have implied throughout the video that there are some concerns around the treatment of gonorrhea. And let me just give you an example from my experience since I've been practicing medicine. When I first started, the recommended dose was 250 milligrams of ceftriaxone. But now that recommendation has been increased to 500 milligrams. Now, why would that be? Well, this pesky little bacterium, Neisseria gonorrhoeae, is developing resistance to this antibiotic. And that's just from my experience of practicing medicine. If we go all the way back to, say, like the 1940s, there used to be multiple antibiotics that could work on gonorrhea. But as time has gone on, as the infection has spread from person to person to person, it has developed more and more resistance to multiple antibiotics, even to the current first-line treatment, ceftriaxone, by needing an increased dose. Now, I'm not here to try to scare anybody, but there is data and concern that there eventually, if this continues, could be strains that are completely resistant to ceftriaxone and potentially untreatable, which, again, can be kind of concerning. And I do sound like a broken record here, but again, that's why it's so important to have safe sex practices, early detection, early testing, and potential treatment, because the more the bacteria is exposed to multiple hosts and spread from person to person and exposed to antibiotic after antibiotic, the more likely it is to develop resistance. And a quick little FYI, often when we treat people for gonorrhea, we'll also treat them for chlamydia. And the reason for that is there are plenty of cases where people can have both gonorrhea and chlamydia. They're spread in very similar ways, and they have crossover in some of their symptoms. Now, if you have a confirmed test that says they're positive for gonorrhea but negative for chlamydia, you can avoid treating for both. But like I said, there are plenty of cases where you will be adding another antibiotic to treat for chlamydia, and that antibiotic is called doxycycline. Now, we have a couple other things to do. One, we have to talk about that nickname, the clap, some of the theories of where that came from. And two, are there other potential sites of infection outside of genital structure, so extragenital infections? And the answer to that is yes. And one of those sites is the anus and the rectum. And you can see that here on this particular cadaver. And the greatest risk for developing an infection in this region is males who have intercourse with males and others that participate in receptive intercourse in this area. Now, it doesn't necessarily have to spread through intercourse in that area. You can also get it based on the proximity of the vaginal canal to the anus. You can see how close those are, and the bacteria could just potentially move into that region. Now, again, infection of gonorrhea in the anus and the rectum can be asymptomatic, but when it does have symptoms, it can have anal rectal pain, anal rectal bleeding, even that mucopurulent drainage, and even this feeling of fullness, like you have to go to the bathroom, but nothing's actually there. Another site that you can have gonorrhea that's outside the genital structures is the pharynx. And pharynx is a fancy pants name for the word throat. And I think it's somewhat obvious how you could get gonorrhea in that region by having intercourse that would get secretions there. So one of the things that we can again have is asymptomatic. But also when they do have symptoms, or I should say if they do have symptoms, those would include things like sore throat, even swollen lymph nodes in the neck or cervical lymph nodes, and you can even get pus in the throat. And the last location I want to mention is the outer clear protective covering of the eye called the conjunctiva. Now this generally is not transmitted sexually. It's most commonly transmitted as baby passes through the birth canal of an infected mother, and it causes a form of pink eye, like a gonorrhea form of pink eye, which is redness of the eye and discharge. And this is treated with the use of antibiotic drops. And finally, what are some of the going theories as to where this nickname, the clap, came from? We'll talk about 3. And the first one is from this French word clapier. Now I apologize if I didn't pronounce clapier right, but this word refers to a brothel. And the idea is that someone at a brothel is more likely to contract an STI like gonorrhea. The second comes from a potential treatment option. I should say an old school treatment option, kind of this medieval treatment, is to take 2 heavy objects, place the penis in between, and clap the penis with these heavy objects in order to express the pus outward and therefore potentially express the infection out. It didn't work, and there's all sorts of potential problems with that in my mind. But let's move on to the third. The third is from this word called clappen. Clappen is this old English word that means to beat or to throb, and this idea was that it would resemble the potential pain from a gonorrhea infection. So those are 3 potential going theories. Why don't you guys comment below which one's your favorite, and we'll have fun discussing why it's your favorite, and some of you are going to be sadistic and probably pick the second one. Thanks for watching, everyone. Hopefully you learned some new and interesting information. If you're interested in testing, be sure to check out the link in the description below for Let's Get Checked. And if you feel the need, like, subscribe, continue to blow up our comment section. And if you choose to participate in coitus before our next video, please do so safely, responsibly, and consensually.